like to invite Dr. Jyotirmay Biswas, who is a stalwart in the field of uvea, has trained many uvea people and has done some path-breaking research in the field of uvea at Shankar Nethralaya, Chennai.
Yeah. Thank you very much. Thank you for giving me the honor of having the B.K. Narayan Award. I dedicate this award to my teachers and my students as well as my patients. I'd like to start with a quotation. The known is finite, the unknown is infinite. Intellectually, we stand on an islet in the midst of ocean of inexplicability. Our business in every generation is to reclaim a little more land. And what I have done over the 33 years is the little more land which I acquired. This morning, my journey in UVIT started 28 years back. So we started with the tuberculosis, and I have made about 16 publications in that one. TB in India is 2 million people develop TB every year. Every fourth patient of the TB in the world is an Indian. Tubercular uveitis has got protein manifestation, can have a small tubercle to a subretinal abscess. Question I asked, what is the ocular morbidity in active systemic tuberculosis? What are the various types of ocular tuberculosis seen? Is Eels disease seen in active systemic tuberculosis? I went to the Tuberculosis Research Center in Madras 1985 and spent 1 year and studied 1,005 patients, and ocular morbidity in active systemic tuberculosis was 1.39% only. Most common was healed focal choroiditis. Interestingly, no case of Eels disease was seen. This was the case of molar tuberculosis of the choroid, which was taken 32 years back. So I started looking into the histopathology department, clinical pathological confirmation of the tuberculosis cases. And I got only 5 cases between 10-year period. So this includes subretinal abscess, granulomatous uveitis with scleral perforation, exudative mass in the anterior chamber, choroidal mass with pan-uveitis. This is a case of a subretinal abscess, which subsequently could not be salvaged and later on lead to the panophthalmitis. When the eviscerated tissue was histopathologically examined, we found myriads of acid-pass bacilli in the subretinal space. We also looked into the new test which came, quantiferon test for TB, and we found that it is superior to the Mantoux test. We studied the ocular tuberculosis in acquired immunodeficiency syndrome in our country. It was published in American Journal of Ophthalmology, the first report from India as well as in the world. We found ocular tuberculosis was in the 4.8% cases of AIDS patients. We studied the subretinal tubercular abscess in southern India and found the timely management is crucial. We also published tubercular uveitis presented as a very rare manifestations like pigmented hypopyon, and which was positive by polymerase chain reaction as well as the microscopic study. We studied polymerase chain reaction and introduced that technique in our country with the 27 publications. This is some form of xeroxing of the DNA segment. The first study was done in 2002 when we found a choroidal tubercle in disseminated tubercular disease diagnosed by polymerase chain reaction of aqueous humor. This is a 14-year-old girl, sudden dimness of vision for 1 week. PCR for the intraocular TB for fine needle aspiration biopsy was positive for Mycobacterium tuberculosis DNA. And what happened to the patient after treatment with specific antitubercular drug? There is a complete resolution of inflammation. We subsequently did PCR study of the intraocular fluid in the suspected tubercular choroiditis. We studied, and which has got the AIOS Nursing Award for best paper in the UVS session. We studied the real-time PCR, which is a fluorescent molecule used to monitor the PCR reaction. Fluorescent entitled by the fluorescent molecule manifolds as the PCR reaction each cycle of amplification. We did the real-time PCR in the eye infectious uveitis, tertiary care center, and multifocal choroiditis, serpiginous choroiditis is demonstrated tubercular tubercular etiology. We did a herpes simplex keratouveitis by real-time polymerase chain reaction. Eels disease, we made 29 publications, which is the most common retinal vasculitis in Indian subcontinent. 1 in every 135 patients in Shankarnetralaya was Eels disease once upon a time. And we tried to find out is Eels disease due to the tuberculosis or not. We did the PCR study of the vitreous sample for Mycobacterium tuberculosis DNA in Eels disease and found around 50% cases was positive for Mycobacterium tuberculosis. We also studied the epiretinal membrane in the Eels disease for the PCR detection, which was published in AIOS, Investigative Ophthalmology and Visual Sciences, one of the highly rated scientific journal in ophthalmology. We found 47.8% of the Eels disease cases was positive for Mycobacterium tuberculosis DNA. This is the agar-agar gel photograph showing the PCR of Mycobacterium tuberculosis DNA. We concluded that cell-mediated immunologic reaction triggered by sequestered Mycobacterium tuberculosis antigen is responsible for Eels disease. We, in fact, found the Mycobacterium tuberculosis DNA in the enucleated eyeball by the histopathologic and microbiological studies like molecular biologic study of the DNA in the MPP64 and AIOS6110 was positive. We also looked at the high-resolution computerized tomography of the chest in identifying tubercular etiology in patients diagnosed with Eels disease and found that particular specific tree in bud appearance in the high-resolution CT chest. We read 300 full-text articles and wrote a review article on Eels disease and update in Survey of Ophthalmology, and subsequently updated in the Journal of Ophthalmic Inflammation and Infections is the same. We also done the long-term outcome of a large cohort of patients with Eels disease, 500 patients, 898 eyes, with a follow-up of 15.8 years, 10 to 25 years. The major finding was bilateral to 81% cases, acute stage oral steroid better prognosis. Intermediate acute stage better prognosis, laser treatment in the proliferative stage, recurrence is 52% at more less than 5 recurrences in 10 years. In intermediate uveitis, which is an enigmatic disease, we describe the pattern of intermediate uveitis in children presenting in the tertiary eye care center in South India. And we also published the Azudex implant and the treatment of non-infectious intermediate uveitis, and you can see that this is a biodegradable material. Study conclusion that was the Azudex implant is a promising treatment for control of inflammation in the non-infectious intermediate uveitis. Evaluation of the cataract surgery in the intermediate uveitis, we found that this can improve the vision in 94% eyes. In serpiginous choroiditis, we have got several publications, 7 publications, and we recently described the macular serpiginous choroiditis. And amphigenous choroiditis is a new entity which was described by us. No large series was available before that. We published the large series of clinical profile treatment and visual outcome of amphigenous choroiditis. In HIV, we are the pioneer in the ocular lesions in AIDS in the country, and we reported the first 2 cases in India, followed by in American Journal of Ophthalmology, first 100 consecutive patients, and subsequently 1,000 consecutive HIV positive patients in India, and found CMV retinitis is the commonest opportunistic infection in HIV positive patients even in the heart era in India. Viral retinitis, we had 20 publications, and we found that the acute retinal necrosis, favorable outcome was seen only in 45.1% cases. Parasitic uveitis, we had 21 publications, and I am not able to show the video now. We did that intraocular nephrostomas spinogerum. First time we did that electron microscopic study as well as the histopathologic study of the parasite. Ocular malaria, we described that one in ophthalmology journal, and we showed that there's a malaria parasite is seen in the choroidal blood vessels. Kala-Jor patients, we described the Leishman-Donovan bodies, and clinical profile of Toxocara we have described, as well as the VKH. We have got 5 publications, and we showed that the incomplete VKH is much more common than the complete VKH. Extraocular signs are far less common than in the Japanese population. Recently, we described the choroidal and retinal anatomic response following systemic choroidal corticosteroid therapy using Swepso's optical coherence tomographic also. In the epidemiology, we are the first to describe the pattern of uveitis in referral uveitis clinic in India. This was possible with a very crude meticulous record of all uveitis cases by hand in register, which I did in 1989 onwards, and presented as the first paper, and this was the first series of the uveitic pattern in India. And with 13 years after, we published the changing pattern of uveitis over 2 decades in a tertiary eye care center in India. We also described the pediatric uveitis and challenge in the uveitis, 6.29% of the uveitis cases. Juvenile idiopathic arthritis associated uveitis we have described. Uveitis search for the cause, we try to find out and found Mantoux test is less useful than quantiferon TB gold test. We also used the high-resolution computerized tomography in granulomatous uveitis and found it is much more useful than chest X-ray. Biopsy pathology of uveitis is my passion, and we have described the various ocular pathologic features of clinico-pathological correlation and various types of uveitis. This was published pathology study, anterior chamber tap, iris biopsy, final aspiration biopsy, and this is a recurrent primary non-familial amyloidosis of the vitreous. I don't want to go into that one. We described the indocyanine green angiography in posterior uveitis, mutes. Management of the uveitis, we are the first to describe the mycophenolate mofetil therapy in uveitis, triple agent immunosuppressive therapy in VKH. My journey in uveitis to 28 years is, you might guess that who is the person. This was in PGI Chandigarh, 1983 at Sports Day PGI. I was trying to cross the bar, and this is that still the quest for the knowledge continues. Without many of them, I could not do. My mentor, beloved chief, Dr. S.S. Badrinath, who supported me, and my another mentor, Professor Narsingh Rao, Doheny Institute, USA, who taught me how to write articles, and whom I will never forget is my photographer, S.P. Govindarajan, who did, and host of the peoples who has helped me. And last but not the least is my wife, Dr. Shubhra Biswas, who actually my first article, Primary Non-Familial Amyloidosis of the Vitreous, came. I wrote 7 pages. River asked me to reduce 1 page. I simply couldn't do it. My wife did it for me. Thank you very much.
Thank you, sir. Thank you for letting us know. We all know, but you know, the kind of studies you have done in the field of uveitis is really terrific. So thanks a lot for enlightening all the ophthalmologists regarding in this